If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner. Welcome to Ask the Doctor. This series was created to assist you in understanding medical issues so you can take charge of your own health. This is our 8th season, and we are airing once a week. This is a live call-in show, so have your phones nearby. In case you don't get through, you can still submit your questions via the internet. Visit netny.net/askthedoctor, or let me know what's on your mind. I'll take those questions for future discussions. For this episode, I have Dr. Katapadi, internal medicine, attending physician at New York Methodist Hospital. Then I have Dr. Montgomery Douglas of the Department of Family and Community Medicine at Medical College of New York, also chairman of the department, and Dr. Robert Seminara, a breast disease specialist at New York's Methodist Hospital. Welcome to all of you. It's a pleasure to have you all back, and I can feel a stupendous show coming on because these guests, I'm sure you've all known, any regulars of Ask the Doctor know that these are 3 of our foremost guests that we've had in the past year, and I'm looking forward to getting into different topics, different things that are going on. But first we have to get to the news. The news won't wait. So, what's been going on in the past week? And I think one of the biggest stories I saw was on vitamin D. Up to 50% of the United States population may have a shortage of vitamin D. And it seems vitamin D is essential in many different areas that we didn't realize. It could be in diabetes and preventing cancer, arthritis. I mean, we always knew vitamin D was good for weak bones, for osteoporosis. It helped calcium get absorbed. But we're finding now other issues which with vitamin D is very important. And the major study that came out of Europe this week showed that people who had low vitamin D levels also scored lower in mental tests, in mental acuity. And this is very important because they found that if you had a low vitamin D level in your 40s and 50s, that you would fall into the poor mental acuity group in the 60s, 70s, and 80s. And people are always coming up, how can I prevent Alzheimer's? How can I stay sharp? And I think we may have an answer, a partial answer here, because it's a complex set of issues that go into making one's mind sharp. But definitely, you don't want to be in the group that has low vitamin D. So what I suggest is you go to your physician and you can order a vitamin D level, and based upon that level can decide if you require supplementation. You get vitamin D from foods such as fish, oily fish, salmon, mackerel, or you can get it from the sun. The sun helps us. 15 minutes a day of sunlight can give vitamin D, or supplements, which are available in the stores, easy to take, and something you definitely want to ask your physician about. So that's important, to ask about vitamin D, and also look in next week's tablet. I went into a little bit more detail. Another issue is suntan lotion. A study came out last week that showed only 27% of men and 46% of women are using suntan lotion. And knowing what we know about the sun's ability to burn, and there is no such thing as a healthy tan, because tan just means you've had damage to the underneath part of your skin. So there's no, being healthy and having a tan don't go together. We know that melanoma is the most dreaded cancer, increases after the number of times you've been burned. So as a child even, if you had several burns, you're at much greater increased risk for developing this deadly form. Now there are some misconceptions about suntan lotion. Some people feel if it was last year's suntan lotion, they can't use it anymore. That's a misconception, because suntan lotion has about a 3-year shelf life. So you can use last year's, even the year before's. Don't throw it out and save money on that. You need about a shot glass size of suntan lotion to make sure it applies smoothly over the entire body. So people wonder, how much should you put on? Use about a shot glass size. Water resistant basically means that if you're in the water for 20 minutes, it's not going to work after that. So each time you come out of the water, put that water resistant stuff back on if you feel. Otherwise, just use regular and keep applying it. SPF 15 is about all you need. That's the highest level. So I wouldn't go pay more to get an SPF 70 because it really doesn't make much of a difference. And one other thing, people get lulled into a false sense of security by thinking they put on suntan lotion, they're not going to get cancer. We know now that suntan lotion prevents against some cancers, but not all. Actually, probably not even the majority. So while you want to wear suntan lotion, you also want to practice other good habits, such as not being in direct sunlight from 10 a.m. to 2 p.m., wearing a hat, wearing clothing that's protective, trying to use an umbrella if you're at the beach during this time. So I hope that that's helpful on the suntan lotion. And finally, a swine flu update. Unfortunately, we had a death, the first death, now we had a second death in New York City. So you don't want to say, well, we got lucky, because I think you can run into trouble. How do you get lucky if somebody dies? But it could have been a much more severe outbreak, and we could have had many more people not only sickened, but dying from this. And we know that this virus is going to head south for our summer, but it will head into the southern hemisphere's winter. And in Australia or South America, it can mutate and can come back in the fall, which is what happened in the 1918 flu that killed so many people. So we had it mild this time, but that virus is on its way down south now. And really, the government is working on getting a vaccine ready, because that's our best bet should this come back in a very tough form. So that's some of the things that are going on in the news. We have now the quiz. And I don't know, some of you are new to the show, but every week we have a quiz to try and get people to use their minds. We were talking a little about preventing Alzheimer's or preventing mental decline. And the brain is like a muscle. You have to use it to keep it sharp. So we have a quiz to do our contribution. Plus, there's a coveted plaque that the winner gets. It's a very special plaque from they asked the doctor. Only 4 people, I think, or 5 people have this plaque. So here's the question and the drum roll. Okay. This is going to be about insects, because we're getting into the summer, a lot of insects all around. Think of an insect. Add the letter G to the name of that insect. Now rearrange the letters, and you're going to get another insect. I need to know what both insects are. So I'm going to repeat it one more time. Take an insect, the letters of the insect. Add the letter G, scramble them around, you'll come up with another insect. And if you know that, the number to call is 718-499-6101. 718-499-6101. I see we already have 2 callers actually, and that's another suspense thriller here. Is it going to be Maddie or Joel? They've been neck and neck in the past 3 weeks, but we'll see who's the first caller. So give us a call back, talk about internal medicine, family medicine, breast disease. We're going to take a short break, but when we come back, we'll go right to the phones. Again, the number is 718-499-6101. We'll be right back.
On the next Tapestry of Faith, we visit the Indian apostolate. Then we go to the Chinese apostolate. Friday at 8 p.m.
Hi, I'm Lorena. On Faith Film Festival, you'll see films of every kind. There's sadness, happiness, and everything in between. And we want to know what you think about them. Log on to www.netny.net/Faith Film Festival and give us your review.
Welcome back. And we're going to get to our 3 doctors now and find out a little bit more about them. Monsignor Bennett, I want to thank you. Has not missed a show in 8 years. Monsignor, you think Maddie or Joel? Maddie. Monsignor thinks Maddie. Let's see how that works out. But before we get to that suspense thriller here, let's talk to Dr. Katapadi. How are you?
Very good.
Welcome back.
Thank
How
you.
long? It's been about a year?
I think, yeah,
Very
just
nice.
about.
It's great to have you back, and I understand you went on a trip, an interesting trip lately.
Yes, yeah, we were in Costa Rica for the spring break with the family.
Did you see a lot of little animals running around?
Not the big ones, but we saw a lot of birds, toucans, hummingbirds, a lot of colorful,
Really?
yeah.
I
birds.
I didn't see anything. I saw a pigeon.
I don't know. You got to meet the right people.
Yeah, you got to go on. I paid. It was a cheap tour I had. We didn't go much. They didn't let you use spray, did they? The insect repellent.
spray? Yeah.
They didn't mind. That's good. Sometimes they were saying the ecology was.
Oh, no,
wasn't-
they didn't, no. I mean, you can't use toilet paper or paper towel
All right,
in the
that's
bathrooms.
you don't have to go into any more detail than that. Thank you.
That's not good.
No, but
yeah, that's
and tell
about it.
as an internist, what kind of patients do you see so the people out there would know what kinds of diseases that you treat?
Basically, I take care of adults, a lot of preventive medicine, so preventive care, and the run-of-the-mill hypertension, diabetes, osteoporosis, thyroid diseases, yeah.
And it's really good
anything.
because the patients have someone to go to, and then if you need to see a specialist, you can send them to a
Yes.
specialist, but many times that's not necessary.
Yes,
So that's great. Thanks so much for coming back, and I'm sure we have a lot of calls coming in for you.
thank you.
Dr. Douglas, who's been with us now must have been how many times? About 5 or 6 times? So
Probably more than that.
one of the most popular guests we've had.
Well, thank you.
And I know
Thank you.
you're working on rebuilding the church in your hometown. It was
Yes.
injured by the earthquake.
Yes, the Portsmouth Roman Catholic Church in Dominica, West Indies, was destroyed by an earthquake back in 2004. And in collaboration with the Knights of Columbus, we embarked on an initiative to rebuild the church. So
How is it going?
it's going well. We had one event at the end of April, raised $7,500.
Beautiful. I know I was there about 2 years ago. We had an event.
Right. Back when it fell, we had an event.
Is that the only Roman Catholic church on the island?
No, actually, that's Catholic is the 6% of the island is Catholic. So there
6%.
are many Catholic churches.
I mean, your sister was in the church, right?
Right. She was a nun in the church. Yes, and that church happens to be the second largest church on the island. It's like a national historic landmark. That's why. And so last time I was here, she actually put it on this website, NET.
Yeah, we're gonna put it on this website so
Yes.
people that want to help can help out.
Thank you.
Thank you. And as chairman of family medicine at New York Medical College, what are some of your duties?
Well, what we do, we train students, in the basics of family medicine. Family medicine is a field where you take care of all patients of all ages, the whole family, and so we train students to do that, and we also in charge of teaching them community medicine, which is a which is a cross between public health and in care of the individual patient, as well as preventive care. So.
That's great. So I know we're going to get to a lot of calls, and thank you again for being here with us.
Thank you very much.
And Dr. Seminara, who has been with us several times and always has an upbeat message to give regarding a dreadful disease of breast cancer, but somehow you come away feeling that there's some hope and things that can be done.
Well, that's important to me, Dr. Garner, because I don't think there's any woman, not a woman in America that should die of breast cancer or around the world. And if we do the proper stuff, that will just never happen again. So we could wipe this dreaded disease off the face of the map. I think it can be done, and with some very simple measures too. And pretty much it's usually the focus of my talk when I come on your show.
I'd like to leave a cliffhanger so that you don't give it now, but they have to stay tuned. If they want to hear that message, they have to stay tuned to this.
Sure.
And I had your lovely daughter today, is a medical student, and she shined.
thank you.
She was clearly on top of the top of the students.
Well, you're very kind, Dr. Garner.
It was really a pleasure.
Thank you very much.
Thank you for giving her to us at Methodist.
Well, it's our pleasure to have her there and train with people like yourself, quite
you.
frankly.
So we're going to get to our busy phone calls now, and we're going to see who this is on line 1. Who might this be? Hello?
Who?
Yes? Hello?
Hello?
Hi,
Hello, this is Maddie Mara.
hi, Maddie. How are you?
I'm hanging in there.
Maddie, you're the first caller again.
Yeah, I'm calling from Dyker Heights.
How do you do it each week?
All right.
It's amazing, Maddie.
Yeah.
So what
I'm having a problem with constipation.
Okay. All right, why don't you turn down the TV, and I want you to listen to the answer, okay?
Okay.
Okay. Maddie, just for those who don't know, is 86, or at least in her 80s, and she's it's like a dynamo. She gets out, shops, does everything, but she says she's having some problem with constipation. Is that something unusual, or do we find this in the elderly population?
Very common thing, Maddie. I'm sorry that you're having it. And can you tell me a little more about it? What seems to be the problem?
No, it seems that I'm...
Maddie, you have to turn down the TV because we have that
Okay.
delay we put in case you decide to curse
All
or
right.
something, okay?
Okay.
So,
Okay.
okay, Maddie. So Dr. Douglas was asking a little bit about if this is did this just suddenly occur?
The thing is, I have to take laxatives in order to go to the bathroom.
Yes. So
And I never used to have that before. Now I'm 88, and I never had all these problems.
Yeah. And when you went to your doctor, what did they say?
I didn't go to the doctor.
Okay. So you're saying you just have, this has just started only in the last couple of weeks, and is it causing you any pain, or it's just difficulty going to the
It's
bathroom?
getting to be now regular, you know.
Your regularity. And what have you
I
tried
have
so
to
far?
take laxatives in order for me to.
You know, Maddie, it seems like this can be a serious problem. I know Dr. Katapadi is thinking of, you know, different things that this could be that we want to treat early on, right?
Well, basically, if it's something new, if it's a new change in your bowel habits,
Yeah.
that needs to be looked into. You know, especially at your age, if you haven't had any screening colonoscopy, you might want to go talk to your doctor about that. Meanwhile, you know, I don't know how your diet is, but usually, you know, I don't know if you go out shopping and buy lots of fruits and vegetables. It's very important to have a lot of fiber in your diet. Okay, so talk to the doctor if you haven't had a colonoscopy, if you want to get that evaluated.
Maddie,
okay?
thanks so much for calling, and please get into that doctor, okay?
Okay.
Thank you. Let's go to Joe now. Joe?
Oh, hi, Dr. Garner. It's Joel.
Oh, Joel, she beat you again.
I know. You know, I was up at 3 in the morning, and nothing's helping.
All right, we have to get Maddie to give some of her secrets out, so we'll know how she does it. But
One day.
what can we do for you today?
So I have a question for Dr. Seminara.
Okay.
I have an aunt who had breast cancer about a year and a half ago. She got operated on. She got chemotherapy and radiation. I think she had one node positive, and it was about a 1 centimeter mass. And my question is, for follow-up, Dr. Seminara, what do you think is best, a regular follow-up mammogram, or is an MRI a better test for that?
Well, that's a real good question. And certainly it sounds like she's gotten all the proper treatment that we offer today. You know, her prognosis, by the way, from what you tell me, sounds terrific, and she should do well and have a full, healthy life expectancy ahead of herself.
Good, thank you.
Without doubt, and it just sounds that way. Now, the thing about breast cancer for someone, as you describe, is this. She got breast cancer once.
Yes.
So her chances of getting it again in the opposite breast, or even in the same side, something that we call perhaps a recurrence, is higher than the rest of the population. So surveillance is extremely important. First recommendation is this, that she remains in close contact with her surgeon. The surgeon, in my opinion, should not be someone who does the surgery and sees the patient 10 or 15 or 12 years later. The surgical evaluation of that patient is extremely important because the physical examination indeed may pick up a lot of things that the radiologist may miss.
Okay.
We have one of the most famous radiologists here with us today, and this is no offense to him or any of his staff, but the point is that x-rays may miss a lot of stuff. So her regular mammogram surveillance is important, and if there's any doubt whatsoever in the examination of this patient, then an MRI is a very useful tool. I'm reluctant to say that every woman should have an MRI, because every woman's not going to have an MRI, and the insurance carriers won't even allow it. Not only will they not do that, but the specificity, meaning if you do an MRI, it might find so many other things that we don't need to investigate that we can end up with unnecessary surgery. But close observation is imperative, and I think it's a good call.
Thank you. Thank you, Joel.
Thank you very much.
You're
Take
very
care.
welcome.
Try next week harder. Maybe you'll...
Okay, I'll try next week. Bye-bye.
Take care. I lost Izzy, and Izzy's been waiting a long time. Izzy, are you back there, Izzy? Okay, we're going to have Izzy call us back. He apparently has the answer to the quiz, so we may. Hold all your tickets, though. We're not sure. We're not sure he's going to get. I don't want anybody ripping up their answers yet, so we'll see. I also wanted to point out Dr. Seminara. Oh, we're back to Penny now. Penny?
Yeah, hi.
Hi, Penny.
Hi.
Do you think you know the answer to the quiz?
Yeah, I think so. Hi.
Hi. We had someone on ahead, but just by chance, he disappeared on the call.
Okay. Yeah, I'm watching you right now.
Patience is a virtue.
But I also have a question for you, but you want the answer first?
Yes, let's hear what you think the answer is.
Okay, the insect is ant, and if you add a G and mix it up, it's gnat.
Excellent, excellent. Did that come to you just suddenly, or?
My 12-year-old daughter.
Wow, that's
Please
great.
hang
She's
up.
going to get the
There
plaque.
appears to be a receiver off.
What I need to do is have you give the phone your address so we can get that plaque to you right away.
This is a recording.
Okay? And Penny, what we need to do is have you call back, okay? Because we had a little technical difficulty, and we're going to answer your question right away. Mary? Hi, Mary.
Yes,
Hi, Mary. How are you?
I'm doing well, thank you. How are you?
Good. Where are you calling from?
I'm calling from the Old Mill Basin section of Brooklyn.
Oh, it's a very nice area there.
Yes, it is.
Right?
Yes, it is. Thank you for taking my call.
What can we do for you?
Okay, I would like to ask a question about non-calcified lung nodules with a bronchiectasis. I know last week you had something on about, pulmonary, and I couldn't get, through to you. So I'd like to know if I can get some kind of a...
Right. Are you a smoker?
No, I stopped smoking 35 years ago. I'm 54 years old.
Uh-huh. And are you having any symptoms?
No.
Just on a routine chest x-ray it was picked up?
Well, in 2007, I had a CAT scan of the pelvic area that picked up a pulmonary nodule on the left lower lung base.
Okay.
And that has not changed in all this time. That stayed stable. But when I went in February, they found 2 small 5 millimeter or less pulmonary nodules on the right side, one on the top and one on the bottom, with this mild cylindrical bronchiectasis.
Okay, I'm going to ask
So
our...
I'm just wondering if this is a very,
Is it something to worry about?
Yeah.
Or is it, I'll open it to the panel.
Okay, I mean, I'll make an attempt to answer that. The nodules, the new nodules, it still needs to be followed up with serial CAT scans like you did the other one.
Yes.
And as far as the bronchiectasis, I mean, did you have like pneumonia or anything in the past, that could have, led to bronchiectasis? I mean, did you have any lung problems in the past at all?
I can't even remember. I mean, I haven't been sick with any kind of colds or flus or coughs in many years. So I don't know. I don't know if the bronchiectasis can be caused by smoking so many years ago.
No, 35 years ago?
Yes, 35 years. I stopped smoking 35 years.
No, I mean, your risk for any smoking-related problems is as much as the general population now.
I think as Dr. Seminara said, when we do certain tests, we find things that we don't know what to do with, and they become a problem because you can't just ignore it.
That's
and
right.
this is one of these examples where we have a very a test that finds things so small that we never would have seen just a few years ago.
That's right.
And we don't know what to do with them. And I think Dr. Katapadi's answer of watching them, but to feel pretty confident that you're watching them, it's not getting out of hand, and God forbid if they do grow, they can be removed at an early stage.
Okay,
So,
and would that lead into what they're looking for? Because now I go back in July for my next test, actually at Methodist Hospital. Is that leading? Are they looking towards a lung cancer? Is that what those?
They're just looking to make sure they're stable, that they don't change. So I don't think they're looking for a lung cancer, but they just want to verify what they think about it, that it would be stable. And when you come by and say hello, okay? We'll look at it.
I shall.
Okay, Mary.
Thank you so much. Bye-bye.
Bye. It's a tough thing, right? Because you find things, and then what do?
I know.
You're really-
A lot of them are, that's why we call them incidental.
Incidental elements. So we have Christine waiting. Christine?
Yes, hi.
Hi, Christine. Where are you calling from? You sound businesslike today. Where are you calling from?
Tribeca.
Tribeca. Very nice. Did you ever go to the film festival there?
I have, yes.
How was that?
It's a little too trendy for me. It's a little bit phony,
We're going out to Boulay in a couple of weeks. Do you ever read there?
Oh, yeah, absolutely. Absolutely. It's pretty good.
Nice, yeah. The new place, right? It's not on Duane Street anymore. It's on Duane Street. It's on Duane.
I think it's across the street now from where it used to be.
Uh-huh. So any dark horses, stuff that we wouldn't know about, a great restaurant there that maybe something we did, a revelation?
Well, the thing is, as a local, most people go to just what they hear, like not as a local, like you just go to like Boulay, and then, but there's this great steakhouse. What in the heck is that? Oh, I'll think of it. It's pretty well known, but I don't know.
All right, if you think about it before the end, you'll tell us. I'm sure others there know what it is. They're yelling it out. So what can we do for you?
Are you the doctor?
Yeah, one of the three. We have 4 doctors here tonight.
Oh, okay. My mom has inflammatory breast cancer, stage 3C. She found out, she has a tumor that was it was outside her body and it was bleeding. And she had 3 months of chemo so far, and she's at her last treatment tomorrow. I was wondering, they didn't give us any time, like any prognosis, like is 6 months, is it a year? Why don't they do that? And what are the complications with surgery that she's going to face?
Well, just one question. How old is your mom?
60. She just turned 65.
65. I must tell you, and our panel, you know, that I've seen several cases of inflammatory breast cancer and advanced breast cancer, cancer which is positive in several lymph nodes. I've seen patients who have had inflammatory breast cancer and nodal involvement, meaning big, large tumor under the arm, such that after treatment with chemotherapy, the lumps under the arm are practically undiscernible, meaning you can't even feel them. So chemotherapy works very well on issues or tumors that grow rapidly, and sometimes the label of inflammatory breast cancer or advanced breast cancer, particularly in someone who's a little older rather than younger, has a much better prognosis than we might anticipate. The reason your docs are possibly reluctant to answer some of your questions, I can't answer. But I do think that if you ask them for a private meeting, they should be able to tell you some of the things I've told you. At 65, what you may read on the internet or otherwise about inflammatory breast cancer is not a death sentence, and she may do very well. So a positive attitude, positive outlook, as well as responses I've seen in my own practice are sometimes very astonishing. So hope for the best and
Is
communicate
it
with
less
your
common
docs.
than regular breast cancer? I mean, I just never heard of this.
I'm sorry, can
Is
you
it
say
more
that
common
again?
than regular breast cancer, inflammatory?
No. Inflammatory breast cancer has been out there a long time. We gave it a name and we called it inflammatory breast cancer, and it's a breast cancer that grows quicker and more rapidly into the lymphatics and makes the skin red and swollen. And it can be confused by the population in thinking, well, I just have an infection of my chest or an abscess or a pimple that's gone awry. And indeed, underlying this is a terrible breast cancer. But it's not something that's terribly on the rise. It's talked of a little more, just like breast cancer is on the tip of our tongues every day in the whole health area.
I hope that helps you, and it sounds like there's a note of optimism there.
I agree.
Thank you.
Thank
You're
you.
welcome.
Let's go to Barbara now. Hi, Barbara.
Hi, how are you?
Hi, Barbara. Where are you calling us from?
I'm calling from Brooklyn.
Which part?
Oh, I'm up in Bensonhurst.
Oh, Bensonhurst. Very nice out there. You lived there a long
Yes.
time?
I have. I'm going on 5 years, actually.
Oh. And where were you before Bensonhurst?
I was in Bay Ridge.
Oh, Bay Ridge. So you made it's not a big trip. It's a few blocks.
Just a few blocks away. This
Yeah.
is a nice neighborhood. Both of them actually are.
Yeah, we always like to go to what's the name of that restaurant where they do the opera on 86th Street? Tommaso's?
I believe it might be. I don't really know. We don't really stay around here much.
I'm going to give you a nice restaurant. I saw one of actually the viewers in Ignante. It's on 77th, I think, and 5th Avenue, Greek restaurant. Authentic Greek restaurant. I know a lot of the Ask the Doctor viewers are in there. So if you want to go in there,
I'll probably give it a shot. Thank you.
give it a shot. Make sure you tell them I sent you. Get a little something. So no, it's
Oh,
okay.
I will.
So what can we do for you?
I actually have a question for the internist.
Okay.
Okay, here it goes. I am starting to get recurrent boils, and they're very painful.
Mm-hmm.
They come maybe once every 2 months, but now it's something that's becoming more frequent.
Which part of the body?
Sometimes it's in the back side. Sometimes now they're starting to come on my back.
Okay, we have two people that I'm going to address this to. First, Dr. Katapadi, and then Dr. Douglas.
Okay. How old are you, Barbara?
31-year-old female.
Okay. And you're otherwise healthy?
I want to say yes.
Okay, and no family history of diabetes or anything like that?
My grandmother is diabetic on my mother's side.
Right. I mean, sometimes, we worry about when you're getting recurrent boils and stuff, you might want to get yourself checked, screened for diabetes.
Okay.
And, I don't know how your diet is. I mean, do you eat a lot of fatty foods? And
I used to, and then currently I just decided to just put myself on a diet, which has actually been helping me. But now that I'm actually watching what I eat, as far as I'm on more salads and greens, they're starting to come out more frequent. So I didn't get them before, but now, and they're painful.
Interesting, yeah. Dr. Douglas, what about antibiotics in a case such as this?
Well, the antibiotics does work, but the thing about boils is that sometimes it may have an abscess that needs to be drained. So the doctor needs to see it and see if it's something that just antibiotics would treat. But if it really is an abscess, then it may just need a small opening, a cut to open it and let it down.
I have to close the loop because we have a surgeon here. What do you do when a person comes in with boils such as this?
One thing I wanted to say about this question is this. Boils are very common, and everybody in their life is going to get 1 or 2 boils at some time in their life. The thing that's very, very important, and you said it, we never know what bacteria is going to be inside this boil. So, if you get a bad bacteria in this boil, a boil can take your life. A boil can spread throughout your body, make you so septic that you die. Don't take boils lightly. See your doctor, do the right thing, see that you're getting better, and under all conditions, if you think you're not getting better, speak to your doc about seeing a surgeon or a family practitioner like yourself who is skilled at draining these things and knows just what to look for. Because some things, Dr. Garner, sometimes little things can hurt us, not just the big things.
Great. I hope that helps you.
It does. Thank you very much.
Bye, Barbara. Now we have Penny back with us. Hi, Penny.
Hi.
I'm sorry about that technical difficulty.
It's okay.
And did we have your name and address off the air for the prize?
Yes.
Good. We'll get that quiz out to you. Why don't you look for it in the next couple of days? Okay?
Okay.
Our crack staff is working on it now. What can we do for you? She got so excited she forgot what she called for.
No. I'm a type 1 diabetic.
Okay.
I had a kidney transplant 6 years ago. I've been diagnosed, I had a lot of complications, and I've been diagnosed with something called bacteria overgrowth.
Okay.
They did an endoscopy and a colonoscopy at the same time.
And you want to know what this means and what the prognosis is?
Because they don't know if it's due to the immunosuppressive drugs I take.
Okay, I'm going to start with Dr.
Or the diabetes.
Let's see what Dr. Katapadi thinks of this.
Okay.
What immunosuppressive drugs do you take?
I now take Prograf and Rapamune, but I took other ones before this.
Okay, and you haven't had any kind of colon resection or anything like that?
No.
No abdominal surgeries other than the renal transplant?
I had 2 C-sections.
How old are you?
I'm 54.
54.
And I am now on probiotics.
And that's all they gave you, the probiotics? Or
Plus, when I get an attack, I have to take...
a course of antibiotics?
Yeah. But they said this is a very rare condition.
It is. It's rare, and, it might have the diabetes also, which lowers your body resistance for infections, and also the immunosuppressive medications might have contributed to it. Usually it's in somebody who might have had some kind of surgery that, if you have like a blind loop, you can get that. But in your case, I guess it's something unusual that has happened. I don't know if you have either one of you have anything more to add.
Nothing to add. Just that, it's kind of frustrating, that, you have this kidney.
It took 5 years to get a diagnosis.
Oh my goodness. So you went to different doctors and keep getting different opinions and you know, things that are rare, that's what happens. You know, it's very common.
Penny?
Yes.
Sorry, I hope that things get better. What's the name of your daughter?
Haley.
Haley. That's the
Haley.
12-year-old that
Haley.
got the answer, right?
Yes.
Very smart.
Yes.
Thank you for calling. Give us a call back and let us know how things are going.
Okay.
Okay?
Thank you.
Thank you. We now have Gloria, who's been waiting patiently for us. Gloria,
Yes,
how are you?
I'm fine.
Where are you calling from?
East New York, Brooklyn.
Oh, did you call a couple of weeks ago?
No, this is my first time.
First time. It sounds familiar. Did you? What about East New York? We were talking a little bit about last week. Good restaurant out there. We happen to be going through the neighborhood. Where would you suggest?
Wow, it's so many.
What's your favorite?
Oh, wow.
Yeah, it's going to be in the book. We're doing a book on restaurants this year.
Oh, really?
Yeah, the Ask the Doctor restaurant book.
Mm.
You think you would buy that?
Well, a lot of times I like to leave the neighborhood.
Okay. Where do you like to go?
When I leave the neighborhood?
Yes.
Long Island City, Queens,
Really?
over near Broadway.
On Monsignor Bennett's out in Long Island City. Where do you like to go?
Is different restaurants up and down Broadway.
Any of them, right?
Oh, yeah.
Which one should I avoid?
Try them all.
Okay, we'll try them all. All right.
I love it.
What can we do for you?
I have a problem with my white cells. They are very low. And lately I've been going back and forth to the doctor, taking blood tests every 2 weeks. Everything is fine, except for they can't understand why the white cells fluctuate up and down.
So are you taking any medications?
Not for that, no. For other things, yes.
And how did you first realize that there was a problem?
Well, this has been going on about 13 years now, off and on.
Let's see what our doctors think. We'll go around the table. Dr. Katapadi?
What's the count?
How low is it?
Well, the last one I took was 800. And before that it was 6, and lower. And then it was normal, up and down.
Wow.
Okay.
So I have to go this week to find out what's going on now.
What medications are you on?
High blood pressure, asthma.
No, I mean, give me the names of the medications.
Trimetine, Norvasc.
Okay.
I take potassium. Excuse me. Hello?
Yes,
yeah,
we're here.
I'm still here.
Yes.
So it sounds like blood pressure, a couple of blood pressure.
Yeah, I mean, sometimes medications can cause that. That's why I'm asking.
Yeah. I take
so, I
Trimetine,
mean,
70-50.
Okay.
Okay.
75-50.
What tests have you had so far? I mean, they've looked at your blood smear. Have you seen a hematologist?
Yes, that's where I go every 2 weeks.
Okay.
And I was there last week. I have to go back again this week.
You've had a bone marrow examination done, or?
He wanted to do it, but each time I go, he put it off. And he said he was going to give it to me. He said something heavy. He said he wasn't going to give it to me in my hip. He wanted to do it in my neck, in the bone underneath my
chest.
Oh, wow.
Yeah.
Okay.
Well,
Yeah, I think that would give you some answers. That's probably what you should, go for.
Dr. Douglas, any thoughts?
Well, the other thing is that you're dealing with something that is very uncommon. You've had this problem for 13 years, and at this point, you should have a whole host of tests to look for all kinds of things, uncommon things, because it's very uncommon for 13 years going to different doctors trying to figure out what this is, and you don't have an answer.
Right.
So I would definitely get a second opinion in addition to what you have now, and and really just basically leave no stone unturned.
I know he's been checking the blood, and he said everything that they check so far, it comes out, everything is fine.
And you don't want it to be not fine either.
Yeah.
You want good news. So.
I'm glad that they couldn't find no other diseases as far in the blood or whatever.
Exactly.
I'm happy about that.
Dr. Seminara had a thought?
Yeah, I just had one thought. Just like Dr. Katapadi has told us, she asked if you've had a bone marrow biopsy, and I heard you say that the doctor decided not to do it because of your size, et cetera, et cetera.
No, he's going to do it.
Oh,
but he's going to give it to me in the neck instead of the hip.
Well, just be advised, my thought was this, that surgeons can help in this too. In the sense that perhaps if the medical doctor or the hematologist is a little bit, let's say, not too thrilled about doing a bone marrow biopsy in a certain part of his body, a surgeon can help him get that job done. But certainly you have to have all the tests that all of our internists tonight have told you to do, and I advise you get them done too.
Gloria, if you need a second opinion, maybe you want to give one of our doctors a call, or if you want to call me at the hospital, and we'll try and get you lined up, okay?
That'll sound great.
Take care. Have a good night. Let's go to Rachel. Rachel, how are you?
Hi, I'm fine, thank you.
Hi, where are you calling from?
I'm calling from Manhattan.
Oh, we're getting a lot of Manhattan callers. The show's getting quite fancy. Yes. What can we do for you?
I have a question for Dr. Douglas. I recently got routine blood work for a job, and everything was normal except my calcium was low. And I'm 29, and I'm pretty skinny and tall, and I'm just worried because, you know, I don't want to get osteoporosis.
Yeah.
And what do you think I should do? What can I do to increase my calcium?
Well, you know, when people go for routine tests, you know, that's one of the things that can happen, that they may get too many tests and find things that are really don't mean anything. So the first thing is to repeat it and see if it's really true, because it was done not because you expressed any symptoms of calcium deficiency, but it was done as a routine. So first thing is to repeat that, because it didn't come from symptoms, it just came from general testing. If it does turn out to be low, then it should be looked into. There are many things that cause low calcium. You know, even vitamin D deficiency can end up with low calcium, because you need enough vitamin D to absorb calcium. When you take in calcium in your meals, if you don't have vitamin D, which is a very common thing these days, we're finding more and more that vitamin D deficiency is actually much more common than we thought. So it can lead to low calcium. Then there are many hormone problems, like parathyroid hormone problems that can cause low calcium. So there are many things that can cause low calcium. But the first step is to repeat it, and then if it is confirmed, then the doctor will ask you more about symptoms of calcium deficiency, and we'll do some additional tests to look into these things I mentioned.
Okay.
Hope that helps.
Yes, thank you.
Okay, feel better.
Thanks.
Let's go now to Cheryl. Hi, Cheryl.
Hi.
Where are you calling us from?
Brooklyn.
Which part?
Bed-Stuy.
Bed-Stuy. Yeah, so we had a caller last week who gave us a restaurant to get roti out there. Do you know that place?
No, not really.
No. Where do you like to go?
Well, there is so many places. I can't give you a particular place but I'm more either. I'm from the Caribbean, so
which part? Which part?
Trinidad.
Trinidad. Oh, how is it there this time of year? Does it rain in June and July, or what?
Yeah, lots of rain, but in August is lots of sun too.
Oh, so which is the best?
Hot sun.
Which is the best month to go to Trinidad?
You go in February, Carnival.
Oh, okay. Did they have that in?
Yeah, same time.
Same time?
February. Yeah, Carnival.
Very nice.
In Dominica.
Dr. Douglas is from Dominica.
Oh, okay.
How are you doing tonight? What can we do for you?
Well, I don't know. I have so much a complication, but I'm gonna start with one.
I missed it. Just say it one more time.
I said I have so many things going on with me, but I'm going to start with only one problem.
Right. Well, let's hear one. Let's hear the first one.
Okay. A couple of years ago, I think 3 years ago, I went to the doctor and I had protein leaking from my kidneys. So I requested a biopsy, and they said that I had FSFG.
Okay.
Okay. So I'm taking a nanopril, 10 milligrams, but I have so much things. I feel so tired. Sometimes my bones hurt. I'm back and forth to the hospital, every 2 weeks.
Let's see what we can get to let's see if we can shed some light on this. Had some leakings from proteinuria.
And she was told she had what? I didn't
What was
hear
the condition you were told you had?
Glomerulonephritis, she said.
Oh, glomerulonephritis.
Okay.
FSG, I think vocal segment, scoliosis or something like that.
Okay. So let's, Dr. Katapadi.
Okay, but do you have any underlying diseases like diabetes or anything, or?
No, a couple years ago, I had adrenal gland. I had one removed because I had Cushing syndrome.
Okay.
And that, just to tell the audience what Cushing syndrome is?
Cushing syndrome, yeah. It's overactive adrenal glands when you have too much of the, hormones produced by the adrenal gland. So, I mean, that they took, you had an adenoma that was causing it?
Yes, and they had removed half of my, so I have 1.5 adrenal gland. I used to take steroids, but I haven't been taking steroids for almost 15 years. But I go like once a year to take checkup and things to see how everything is doing.
Okay. And how much of protein are you leaking in the urine?
Well, the last that I went, it was 3 point something. I couldn't remember the something.
3 grams.
It goes up and down.
But your renal function itself is it in the normal range?
That's what they say, but I kind of worried because they said that it's okay, but then every time I go, like, the protein goes up.
Right. Yeah, no, I mean, the protein leakage, especially when you're losing that amount of protein, yeah, it can cause a lot of problems. So you're seeing a nephrologist?
Yes, I go to see the renal doctor like every 3 months.
Okay. Yeah, I mean, your symptoms, you're having, symptoms going into several systems in the body. So I think I would probably want to know more of your medical history. So either, I guess, going back to the nephrologist or the internist, or if you want a second opinion, you can come and see me or anybody else. It looks like there's a lot going on with you. I don't know if Dr. Douglas has anything more to add.
Yeah, the only thing I would say, the condition you have where you're losing a lot of protein, I mean, you would end up feeling weak. But what is your question, though? What is the question that you have?
I want to know if is there any other medication that I can take or something besides the nanopro, because they said that's the best medication, but my skin is so dry. It's a whole complication. I don't know. There's a whole lot of things going on
sounds like
with
she's
me,
frustrated
with my
and
body.
looking for something.
Yes, I'm sorry that you're having all this difficulty. I mean, you have the glomerulonephritis, which is, intrinsic kidney disease. And then you have a lot of protein that you're leaking. And nalopril, by in and of itself, is probably not going to be enough to stop all that protein leakage. So you need to be in close contact and working with your kidney doctor to try and figure out how to help you with that. You've had a kidney biopsy, I'm sure, and they've looked at...
Yes, I did have a kidney biopsy.
Right. So it's one of those things that that does need a lot of, as you said, there are many different things that you have. And I hope that you're also taking good care of yourself otherwise and not letting this frustration get you down, because your spirit will knock you out if you don't tend to that as well, your spirit.
Well, I try to keep my spirit up, but every time I go by the doctor, I get different stories, and then I come back feeling depressed.
Exactly. She needs a second opinion. I think that would be good to have Dr. Katapadi can look it over, or any other doctors that you wish. But I think I would get a fresh set of eyes looking at it, okay?
Yeah, I just want to add something. If you're having problems with the medication itself, there are other options. If you think you're having side effects of enalapril, there's another class of medication.
My mouth used to be very dry at night. I drink a lot of water, dry that I feel like my tongue is so heavy.
Yeah, you know what we're going to do? Because we've got to move on, but I want you to please call for that second opinion, okay? And thank you. Thanks for calling.
Yes,
okay, take care. We're now going to Nilu.
Yes.
Hi, Nilu. What does that name mean?
Nilu?
Yes, it's a nice name.
It's a sapphire in India.
Oh, sapphire.
It's the Indian name for sapphire, yes.
Very nice. Sapphires can be costly. I found out my wife.
I don't own one.
Yes. Oh, no sapphires. Where are you from?
I'm from Queens.
Oh, and what do you like to eat out there?
Oh, everything.
Are you an Indian food lover?
No, because I'm Indian. I prefer everything else to Indian.
You like a kosher deli?
No, not
No, it's
really.
a little fatty. Yeah. What do you like?
I like Thai food.
Thai is good. It's healthy.
Yes.
Yeah.
That's one of my favorites.
Thai food. What can we do for you tonight?
Okay, I had a hysterectomy done, a laparoscopic hysterectomy 4 weeks ago. And I read somewhere recently that lack of estrogen can also lead to the heart being affected. Women get more prone to heart disease. Is that true, and what can I do to prevent it? I cannot go on hormone replacement therapy because I have a strong family history of cancer.
Okay, so Neil, I'm going to ask I went to Dr. Seminara to just shed some light quickly on laparoscopic surgery, to have that done, why that's better, or maybe better for the patient.
Today, there's a lot of advances that have been made in the field of laparoscopic or minimal surgery. What's really important for the patients to understand is smaller is not always better. Smaller is not always bigger. Now, Some of the laparoscopic procedures provide a quicker return to work, less risk sometimes as for the lungs and heart, but sometimes it doesn't. So one needs to always be, if you're the patient or on the patient side, cautious as to why am I choosing this procedure. But there are a lot of procedures out there today, particularly for lung and lung biopsies, which used to carry a lot of risk. So there's a lot of laparoscopic procedures out there and ways for patients to do that.
And what I briefly, if the two of you, Dr. Katapadi and Dr. Douglas, can address the issue of estrogen replacement in a patient whose status post, I guess, total hysterectomy, had the ovaries removed and the uterus?
Yes.
Okay.
So basically your question is, are you at higher risk for cardiac disease? Is that what you're asking?
Yes.
Okay. What age group are you in? I mean, in the 40s, 50s?
I'm 51.
51, okay. So you were already close to menopause if you were not, already menopausal or perimenopausal.
No, I wasn't menopausal.
Right, but okay, so in a couple of years, next couple of years.
Right.
So, I mean, years ago, like what you said, you did some research and saw that there was increased incidence of cardiac disease. Years ago, there was a study done that did show increased incidence of cardiac disease, especially after a surgical menopause. But since then, there have been several studies that really didn't show any difference. I mean, really, it was years from menopause that increased the risk of cardiac disease. That means if you had a very early menopause because of loss of your hormones, which are cardioprotective, you developed cardiac disease. I mean, your risk of cardiac disease after menopause, whether it's surgical or otherwise, became same as men. So, I mean, basically, it goes back to your risk of cardiac disease goes back to your physical activity level, your diet, the usual risk factors for cardiac disease. If you have family history, if you're a smoker. So if you eat healthy and exercise at least 30 minutes every day, and you don't have significant cardiac history, and you don't have other medical problems, like high cholesterol or whatever that contribute to cardiac disease, I don't think your risk would be different just because you had your ovaries removed.
Thank you, Nilu. I'm going to have to move. I have to move on because we have a lot of callers. Thanks for calling. We're going to now do like a rapid fire answer. Okay. Carmela.
Yes, hi, how are you?
Hi, Carmela. What's the question tonight?
My question is this, I have a low back pain that's very painful. This has been going on for like several years now. It's going to my left hip, but before that, in 2004, I had a mitral valve replacement. I had a lung biopsy. I have a lot of complaints. I have COPD, sarcoid, fibromyalgia. And the doctors give me different medication, and I put on gaining weight, and nothing helps me.
Okay,
I'm using Lyrica. They give me Vicodin. I'm using Singular, Sporiva, Zoloft with depression. It's so many things, and I need to find out. My body is so immune to it. Now I got body cramps at night. Several years I can't sleep properly at night. I sleep at 2 hours because in the middle of the night I jump off the bed. The cramps is so bad in my upper leg, and my back, my neck, everywhere. I need help.
Carmela, I'm going to turn it over to Dr. Douglas because we only have a little time. She has sarcoid. She has all kinds of pain, mitral valve prolapse, no pain medications working. What can she do? Pain management? What is it?
Yes, it's a difficult situation you're in where you have the fibromyalgia, which is difficult to treat. You have the low back pain. And now your question is, what do you do? Because you're already taking narcotic medication, namely the Vicodin. And I'm sure you're taking something for the fibromyalgia. Well,
I need help. Could I see one of you guys to advise me on something?
You know what I'd like you to do is call us tomorrow. We have a pain management center over at the hospital. You need that. You need to get into it. So you can either call Dr. Katapadi or my own office, and I'm going to set up an appointment for you. You're going to get help.
Is there a number? Somebody give me a number to call you guys?
Yeah, the number's going to be up on the screen, okay? And I want you to call it, okay? Just look at your TV. You're going to see the number.
Thank you very much.
Okay, Carmela.
Please.
Thank you, Carmela.
Thank you.
Teresa.
Yes.
Hi, how are you? I'm sorry we have a short time. What's the question?
Okay, I have, my husband is on a respirator, and he's been on it for the past 10 years. Now, what he wants to know is he has a trach in his throat, and he's able to walk around. He constantly gets bloated, and he constantly has his speaking valve on. Now, would this cause him to blow up with a lot of air? At times he takes it off, but most of the day he's on with the speaking valve so he can talk. So he wants to know why he constantly feels bloated and he feels like he can't breathe. I mean, he has emphysema.
Yes.
But he's just very uncomfortable.
Okay, we're going to try and get a quick answer, Dr. Douglas.
When you say bloated, are you talking about in his belly or in his chest?
In his stomach, and yet then there's times he has some pulling in the chest. He also has oxygen. He's on the ventilator, plus he has to have oxygen.
Okay, the first thing I would do is have that thing checked. As they're using this valve,
yes,
sometimes the air could be going down in the belly and stomach instead of the lungs. So it could bloat him right up, and that could make it very uncomfortable, especially someone with emphysema who already has overexpanded lungs. So I think the first thing is to check that. The next thing is the emphysema management being maximized? Emphysema is one of those things that can get worse over time, and if it's not well managed, then it actually just gets more and more expanded, and next thing you know, it's pushing on the stomach.
Yeah. He's
Lisa,
very
I hope that helps.
uncomfortable.
Call back next time earlier in the show, okay?
Oh, okay, I was trying to get through. Thank
Sorry.
you for the...
We're going to have to expand to an hour and a half, I think. Yeah.
Okay.
Thanks a lot, Stacy. Let's go with Stacy.
Hi.
Stacy, hi, how are you?
Hi, how are you?
Okay, what can we do for you?
I've been struggling with a lot of choking episodes for the last 9 months.
Choking.
Throat constrictions. I went to a gastroenterologist and I went to ENT. They told me that it could be a severe case of acid reflux, but I've been taking medication for the last 8 months and I'm still getting these terrible choking episodes.
So Stacy, I'm going to ask Dr. Katapadi to...
Yeah, so you've seen the right specialist. Have you had the upper endoscopy?
I had.
You've had, and it was normal?
It was normal. They did see a little bit of scar tissue, they said, and they said that the flap that separates the stomach from the esophagus was slightly open, which was causing maybe the acid to go up in my throat and causing the choking episode.
So you do have acid reflux, and are you on treatment for it?
I'm taking omeprazole twice a day.
Omeprazole, okay.
And I'm still not really seeing a lot of improvement. I'm still getting a lot of throat tightening and
How long have you been taking it?
About on and off for about 8 months.
8 months?
Stacy?
Yeah, it looks like you might need further evaluation.
We're going to need further evaluation. Again, if you call the number on the screen, Dr. Katapadi can set up an appointment for you and get in and talk. Okay, and thanks for watching us.
Okay, thanks.
This is time. We have to go. We have to go. It's just we don't have enough time. We need more time in the show. And I told you it was going to be a great show. And Dr. Seminara, I forgot to mention your presidency, which is a very important position at the hospital, representing the physicians and making sure that the patients are getting the proper care. So thank you very much for that role.
Pleasure.
And that's it for this edition. I want to thank Dr. Katapadi, Dr. Douglas, Dr. Seminara for being here, for taking your time. And we hope that we were able to help you. I'm sorry we're so short of time, but it's good that you called in, and good to remember that you should be proactive about your own health. You speak to your doctors about your concerns. Go for second or third opinions. In the meantime, continue to watch this show every Tuesday night or visit our website at www.net/askthedoctor. That's ny.net/askthedoctor. On that site, you can get video blogs, past episodes, send in questions. I want to thank you for all your calls tonight. And I'll see you again next week at 8 p.m. Goodbye, stay healthy, and see you in the tablet.